Jackson Hospital Emergency Services physician, Dr. Jacob Sinkoff. Good morning.
Morning. Thanks for having me.
Yeah, thanks.
Guys.
Thanks for schlepping up here in the cold.
Yeah, it was cold. It's cold this morning.
Very cold.
Yeah. Shouldn't you be wearing a long sleeve
Yeah.
shirt?
I have a jacket. I have a
Parka.
Yeah, I have a windproof zip up, and then I got a jacket.
You're good to go.
I grew up in Wisconsin. I'm not walking around in shorts.
Yeah,
but
which we see quite a bit here in Jackson.
we got some of the Jackson. Oh yeah.
Yeah.
Oh yeah. We got people that are only in shorts.
Do you ever have anyone come into the ER at -5 degrees wearing shorts? Yeah.
We were just talking about that yesterday. I worked yesterday at the 1 a.m. and we have
Yeah.
always saying always in shorts.
A lot of people wear shorts in the winter.
I don't understand it. I've never understood it. Football coaches, once in a while, late November, you get to see that. Jeff Veach has only worn shorts his entire life.
And sandals. Open
toe sandals.
Yeah.
So
I think we talked about it. I'm pretty sure we talked about it last year during the call. You know, like in high school, there's always the kid
Right.
never will wear a jacket
Absolutely.
and always is wearing shorts.
Yep.
You know, one of the two. And
What type of risks? I mean, this morning it is brutal.
It's cold, so you want to try to keep all your skin covered, especially with the wind, and that wind chill can really cools down the skin. You get frost nip and progresses to frostbite pretty fast. Usually we see it on extremities where blood flow is less, so fingers, toes, then obviously face, two cheeks, nose. So trying to keep those areas covered. Especially wearing a hat, you lose so much of your heat through your head. So wearing a hat is really important.
I've never heard frost nip.
Oh yeah, that's the
It's
Frost bite.
Yep.
Huh.
Yep. So,
and frostbite can happen within 30 minutes.
Yeah. Oh, even faster than that.
Really?
Yeah. Things that accelerate it, getting wet. So I always warn you when you're out in the wind, because sometimes, especially during the day when it's decent out, it's 20 degrees out, especially when you're a kid, you're out running around, you actually start sweating. Your mom has you bundled up. And when the sun goes down, especially like outdoor, I remember camping as a kid. If you get wet, that's the worst thing that can happen, because then when it gets cold, all that clothing, all that moisture freezes and cools you down so much more.
They can actually lose fingers and toes.
Oh, absolutely.
On Monday, there was, I'm sure you heard about the fire out at Clark Lake and those firefighters blazing that blaze with the wind, and most of their jackets were just covered in ice.
Yep. It freezes instantly.
Amazing.
So
I can't imagine those. So shout out to firefighters who were out working in that weather. That's crazy.
Yep.
Yeah, and by the way, there's a GoFundMe established for that family, and if you visit Clark Lake Spirit website, you can get all the details on how you can help that family in Clark Lake.
Yeah, I didn't realize, I was doing a little research this morning, I didn't realize that the flu hospitalized so many people across the country. It's crazy.
Yeah. At the CDC, it's hundreds of thousands already this year.
Yeah,
and starting to get, so thank goodness, I think RSV has peaked.
Okay.
They're saying now, but pretty good RSV season affecting the little ones, and then also elderly, which is why it's important to get RSV vaccines now, which they recommend not only in kids but in elderly patients now too. But it looks like the RSV season has hopefully peaked. We're still seeing a lot of it, but influenza is pretty bad right now.
Yeah.
So every shift seeing a lot of RSV influenza in the hospital. Subtype is influenza A, so seeing a lot of influenza A.
I've heard the hospital is full.
It's full.
Yeah.
I think we're turning a corner, hopefully, but it's full staff, all beds full.
I'm gonna ask a question about hand, foot, and mouth, because anytime I hear hand, foot, and mouth, same thing as you. You just freaked out a little bit, didn't you, Bart?
I do.
Like if you're like, oh, so and so has hand, foot, and mouth, you're immediately like, ah.
Yeah.
What is hand, foot, and mouth?
So it's caused by a virus. I believe it's Coxsackie virus.
Okay.
And the classic is it causes these kind of vesicular-like rashes that affects the hand, mouth, and feet. So a lot of times, like, it went through my household. I didn't get it, but my kids had it last year.
Okay.
Usually you get a fever kind of preceding it. And one of my children had a fever for about 3 or 4 days.
Really?
And we actually thought enough to bring him I wasn't good enough, so we brought him to the pediatrician. It was like, I don't know, they're probably fine, So I was like, "Hey, you should probably bring them." I was like, "Yeah, you probably should."
That's funny.
And so sure enough, we get to the pediatrician. They look in her mouth, and it's like, looks like she has those vesiculars. So some people don't even develop the rash, and it doesn't have to be all three places. It can just be around the mouth. It can just be on the hands. It can just be on the feet. But it can affect people at any age. And it's pretty it's painful, very painful, especially you get in the mouth. It can people can get dehydrated actually, especially kids because they don't want to eat or drink anything just because it hurts so bad. There's been professional athletes that I remember. I think it was on the Mets. A pitcher had to go on the injured list because he had hand, foot, mouth, and it caused of blisters on his hand. He couldn't throw a baseball. So. Yeah, I haven't seen much of that yet.
That's good.
Knock on wood. Yeah. Yet this
year. It always freaks other parents out. I don't know. I guess
it's
because you can see it probably.
Yeah, you can see it on people's hand. It is kind of, it's funky looking,
Well, it's the name. I mean,
it's the name is awful.
Yeah.
It gets to the point, though.
Yeah, it
it's
does.
Hand, foot, mouth. Yep. So, but yeah, it's like kind of a misnomer. It can be one, some people don't get the rash at all, and they just kind of have this fever for a couple days and feel bad, and some people just get it one or two spots. So, hopefully no bird flu yet, though.
Yeah, hopefully not. Well, if your family needs any care, go see Dr. Jake at IEP. And if you need the ER is open, but please don't wear shorts. Yeah. Dr. Jake, thanks so much.
Yeah, thanks for having me.
Jacob Sinkoff here on the Morning Show. Stay with us. More coming up next.